And I want to say good afternoon to all of you here in the room and also out there in space. I hear we have a lot of attendances, so I'm really happy with that. So I'm Susanne Bennekow. I'm a regulatory toxicologist from Denmark, and I currently work at the Danish Patient Safety Authority on environmental pollutions and chemicals, but I've been at the Danish EPA and also the Danish Technical University before. And then I've also been involved in a lot of EFSA mixtures work. So I guess this is the background for me being here today. So I want to invite you to engage in this thematic session on combined exposures to multiple chemicals across regulatory silos. And we are here today to discuss ongoing and future developments regarding human risk assessment. In particular, I think we are at the time, and I've been involved in mixtures risk assessment for so many years here in one sector, mainly the pesticides. That's my background. This is the time, I think this is the signal to think about how do we implement the methodologies that we have available now that has been developed over the years, and also think hard about how to integrate this. And this is the, I think this is the objectives of this workshop, or this session. We are here to discuss these experiences and learnings that we have, and explore which methodologies would be helpful coming from the different sectors. And then we need also to think about identifying and prioritizing the necessary scientific advancements that we need to really to address this topic across the different sectors. And how can we actually underpin this development? So with the speakers we have here today and the discussion we have here today, we hope that the outcome will be that we are in a situation where we can identify possible synergies amongst the stakeholders that we have here, and also stimulate further scientific advancements. And this, I think, would also serve as a good starting point for clear legal and regulatory requirements for mixtures risk assessments across the silos here in Europe. So before we venture into that, just a few housekeeping things. I guess you all are acquainted with the app now. This is where we want to engage with you, and we will have we will use this this possibility during several occasions in this session. So we will want to ask you to post questions through the app. We would also encourage that you like or dislike questions that you see in the app, because this will guide our rapporteurs here. They will sit and look at all the questions coming, and then they will kind of filter them, and then it will make sure that we discuss the questions that most of you found interesting or stimulating. So please do that, and later on we will also have a poll, and you use the app for that as well. I think with this, I think we can start the session right away. And for the first part of this session, we have a keynote speak by Chris Gennings. Chris, please. And Chris Gennings, she's the Director of the Biostatistics Division within the Department of Environmental Medicine and Public Health at the Icahn School of Medicine at Mount Sinai. She's the Director of the Statistical Services and Analysis Resource in the Human Health Exposure Assessment Resource Data Center. So the floor is yours, Chris, please.
Thank you very much, and I really appreciate the opportunity to be here. I do think it's kind of bold to have a plenary talk as a biostatistician, because we're usually the ones at the end of the day and everybody's asleep. So I'm going to do my best job to try to engage you to think about the kinds of metrics that I've been working on and I'm going to show you today, with the idea that maybe these are metrics that might be useful in your world. And I hope at the end of this session we can kind of meet in the middle in terms of your questions, and maybe I can explain a little bit more about how this might be relevant to your needs. So just to sort of set the stage a little bit, my sort of bottom line is I'm trying to encourage the use of epidemiology data in risk evaluation and risk assessment. The advantage, of course, of epi data is it's human relevant. The second advantage is that we might not know the source of the exposures, but you sure do put all the chemicals together and can measure things. And that can be from targeted and untargeted analytes. I'll only show you today some targeted examples, but I'm going to use as an illustration the Selma cohort, which is in Sweden. It's a pregnancy cohort, about 2,300 women. My sample size today will be a little bit smaller than that, but I'll show you some results from that. The idea there is to link sort of an exposomic approach where we can take toxins on one side, but then have the nutrients on the other, dietary nutrients on the other side, and how those might play sort of against each other. We're also taking, and I'm going to show you that with the metric of weighted quantile sum regression, and I'll show you an example of that. And then the My Nutrition Index, I'll show you that as well. And then I'm going to take a step a little bit further, and with a step towards causality, that might be a way we can interpret some of these results of the WQS a little bit better. So I hope you can stay in tune for that. And then finally, there are a couple of models that I'm going to show you where we're using empirical data to estimate points of departure, which can be compared to biomonitoring equivalent levels. And I think that's kind of an interesting kind of concept to think about. And then finally, the similar mixture or SMAC approach that combines epidemiology and experimental evidence. So we'll show you that. So thanks to Christina Rudén she's on the call today, but the graph on the left demonstrates that our exposures as humans come from all kinds of sources. And that's the point I'm trying to get to with the use of epi data. It doesn't really matter where they came from. What matters is it's a body burden to the humans. It also, when you think about mixtures evaluation from a biostat perspective, there's all kinds of research questions that you might focus on. And I think we get a little bit disentangled with that. And so what we are focused on is the question of a mixture effect, where we're trying to see the overall effect of the mixture, and I'm going to call it a mixture effect. So what is a mixture effect? It's this concept that our friend Andreas over there helped bring around, this idea of something from nothing. And we see that in epi data, so not just in tox data, where we might have individual exposures might be low enough that individually you might not see a significant effect or an association. But when you start trying to put them together so they can sing the same song, right? They're jointly working together, then all of a sudden you can see an effect. And I think that weighted quantile sum regression is a strategy. It's not an only way, but it's a way that maybe we can address this issue of how to measure a mixture effect. Okay, so what is weighted quantile sum regression? So I got a little schematic here and see if you can follow this. So suppose we have 4 compounds that are correlated. So what you're looking at there is a correlation heat map. So the different colors tell you that the different combinations have different correlations. That in higher dimensions, that's a real problem for challenges statistical methods. But the approach that we're taking is going to be in that framework. The other thing is we're going to create a weighted index. So to make the weights interpretable, we're going to put everything on the same scale. And we're going to do that by putting them on quantiles. So it could be a decile, it could be a quartile. But we're going to take concentrations of each component and put it in quantiles, and then we're going to estimate weights. We're going to do that by taking our subjects and splitting them apart into a training set and a validation set. And the training set is where we're going to estimate the weights. So let's see if this little, oh, it worked, okay. So we can estimate in a weighted, it's a nonlinear model. This is things biostatisticians do all the time. We can estimate the weights that would construct this weighted index. But because of that correlation among the components, we want to do that many times. So it's called bootstrap sampling, if you're familiar with that. So we do that multiple times, let's say 100 times, dot, 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 and now we have an average across those, which is going to be more robust to picking up signals from different sources that might be correlated. We take that weighted index from the validation data that hasn't been used yet, right, the holdout data. We construct a weighted index, and we could get a slope from the training set. A little bit attenuated generally will be the slope from the holdout set, and so we get a beta and a p-value there. So that weighted index then has this ability to evaluate chemicals that might be working similarly, not in terms of slope, you know, that kind of thing, but maybe acting on the same pathway or whatever to be associated with an effect. So that's, oops. Oh, there's the beta and the p-value. Okay, so now just switch off a little bit, just an aside. On the other side of this is nutrition. So we've got the toxicity that we might measure from either targeted or untargeted assays. What about nutrition? So we've developed an index called My Nutrition Index. That's my daughter up on the left side. Isn't she cute? So the question is, she'd kill me if she knew I had that picture. The question is, what's right for me, right? And so nutrition, I think, is a very personal thing. It has to do with your characteristics. How active are you? You know, what your age is, what your sex is. Do you have medical conditions? Are you pregnant? I mean, all kinds of different things. And so what's right for one person may be very different for another person. So there is no one size fits all. So we've created this index called My Nutrition Index, meaning personalized. And it's comprised of dozens, I think it's 35, 36 different components now of macro and micronutrients. And it actually is a way that incrementally you can evaluate your personal choices of dietary nutritional value, right? And it can even be incrementally used. We worked with an IBD, irritable bowel disease dietitian to help evaluate it. And, you know, it can be something that's incrementally. What we can also do is use that in regression models. And so that's what I want to demonstrate here. So this is an example of the Selma cohort. And we're looking at prenatal exposures, prenatal dietary assessment, and 7-year IQ of the child, right? We have various covariates there that we've adjusted the models for that include child and maternal characteristics. And we're doing this in an R package that's available. It's a GWQS R package. If you're a programmer, you might check that out. But what we're going to do also is a little bit extended from what I just showed you in my little schematic. And we're going to do this now in a stratified way where we can estimate an index, but we allow for different weights for boys and girls, or whatever the strata are that you're interested in. So we're allowing for the fact that an endocrine disrupting chemical, it may be very different from boys than it is for girls. So we need that kind of opportunity, right? So we're doing the same WQS approach, but we're allowing for these different weights. So what you're seeing on the left-hand side there, I don't know if I dare do this. There you go. See the left-hand side, boys and girls. And what you're looking at are histograms and box plots of if I do that repeated holdout, if I do that holdout repeated times, say 100 times, I'm going to get a little bit different estimates on the weights because of that splitting of the data. And that's what you're seeing there, right? The average of that is presented over on the right. Oops, sorry, I knew I was going to mess that up. On the right side, I'm not even going to point at it. The divergent plot, right? The blue are the boys and the red are the girls. So you can see that that's the histogram on their sides, right? You can see that the weights are different between boys and girls. Well, that's what we thought might happen, right? So we want to have that opportunity to do that. What you see on the bottom right-hand side are confidence intervals on the beta coefficients associated with that weighted index. So we've got one for boys and one for girls. And if you can see in the middle is the 0, meaning if the confidence interval includes 0, there's no association. And the blue is significant. So there is a boy effect there, right? You see a decline in 7-year IQ in the boys that you don't see in the girls. But look at the My Nutrition Index over on the right, the green. That's now in the other direction. So better nutrition prenatally. And we know that concept. I mean, I'm not trying to prove that concept. I'm trying to find the metric that measures that concept, right? I'm trying to find the metric that says this is an index that tracks the way it should, that good prenatal nutrition has a benefit, right? When the little brains are developing, it's a good thing. Okay. But that's hard to interpret. When we go back, let's see if I can go back. So if I'm trying to interpret that, then people are going to say, okay, 1 quantile increase and I get or a decrease in response. It's hard to describe what a quantile change means of a mixture, a weighted index, right? So we said, well, can we interpret that a little better? So this is where we're going to take we're going to take a step towards causality. Okay, we're using observational data, but we can make some assumptions, and let's assume that we can do that, right? Assume that you buy the temporality and the confounding issues, and you're measuring what you really think you're measuring, kind of thing. If we had a single compound, we feel comfortable looking at exposures and saying, if we change that exposure, here's what could happen. So it's the what is versus what if, right? This is a paper of childhood asthma changes in air pollution. We want to do that same thing, but now in terms of a mixture, right? So I've got a weighted index different for boys and girls. I want to ask the question, what if we could take that distribution? So over on the right-hand side there is the histogram of the WQS index. You can see the mean. What if we could shift everything over at least lower than 1 standard deviation below that mean? Well, now we've got a guide, we've got a target, right? If we could do that, this figure is saying that the 0 here is the mean. If we could change it for here's the boys and the girls, we see an increase in 7-year IQ. Maybe that's a better way to interpret this index, to say, if we can make this change, here's the change that could happen in terms of something that's meaningful to people, right? And on the other side is the same thing for the My Nutrition Index. If the women eat better as measured by My Nutrition Index, you would see an increase, okay? So what advantage does that give us? So here again is, oh dear, okay, sorry. Okay, here's where we were before, right? The index distribution. This is actually per woman. There's a color code for the class of chemicals that are part of the WQS. The brown there are the persistent chemicals. Good luck getting rid of that fast, right? But the others, maybe we could more simply change them. What if we had a guideline that said, what if we reduce everything other than the persistent? We're going to do our best getting rid of the persistent, but suppose we reduced everything, let's say 30% to what it is now. If we did that, look, the histogram of the WQS recalculated based on proper adjustments is below that red line, right? That gives us a target that we could use to go further on. And similarly, though, if we said, oh, let's just get rid of the plasticizers and leave everything else, sorry, it's not low enough. Okay, so this is a metric that we might be able to use to interpret changes that maybe we bring apart, we ask our public to help us along with that. Okay. Now I'm going to show you 2 different models, one that addresses issues about regulatory guidelines. This is the idea where we say, if we have consumer products, we allow for a certain level of exposures because we like our consumer products, right? But we want to have that concept where we say, well, too much is not enough. And so the question is, where's too much? So what we did is we said, we're going to take this function that's here and say up to some point it's okay, beyond that it's not good. Okay, we're imposing that function into our regression model. Don't worry about the details of that, but we can do that and get a parameter that we can interpret, right, about where that point of departure from empirical data might be. So let me demonstrate that here. What you're looking at here, these are chemicals that are part of the Selma cohort. First trimester concentrations. The D is the median, the P is the 95th percentile, and the U is the maximum value. The B are the BE values, right? So there are some cases where the exposures are below the biomonitoring equivalent values. Look at the PFASs. Way down there at the median. That's a problem. But others, we see that the Bs are sort of the biomonitoring equivalent is sort of below where we have maximum exposures, but not too far up. Now, if we put that same figure, now what I'm plotting there are the S's and the M's are our estimates for empirical estimates of by a point of departures, right? Sometimes we see that the M and the S are very close together, and I can explain that, but I don't have time, but way below the B's, right? The biomonitoring equivalent are coming from animal studies one at a time. Humans aren't exposed to one at a time. Maybe this is a way of giving a data-driven idea of, you know, if we're 2 orders of magnitude below the BE value, maybe we need to have an adjustment factor based on this data, right? So these are ways that we can maybe use such an empirical strategy. A second way is this idea of SMAC. And so the EDC mixed risk, I have some of my colleagues there, we're part of that we've recently published in the Science article. But it's the idea of saying, what if you have a mixture that you've composed? And we did this in the EDC Mixed Risk Consortium, where we took the Selma cohort and we said, let's identify chemicals that are associated through WQS with a neurodevelopmental outcome. We used language delay at 2.5 years. And then we constructed experimentally evaluation of those, a point of departure from that mixture, right? That was done. Anyway, I won't introduce everybody, but so we took the Selma cohort, the reference dose we're calling mix in. We have to do this concept of sufficient similarity to say if we have a mixture, what about an individual's mixture? Are they sufficiently similar to that? So the concept is a lot of details I'm just glossing over, but I can tell you if you like. If they're within this circle, we're saying that's similar. We have evidence of similarity. It's a equivalence testing strategy, so it's got nice statistical properties. And then for people who are sufficiently similar to that mixture, then we can use those people to evaluate the point of departure. And we can create a similar mixture risk indicator as sort of analogous to like a hazard quotient sort of thing, except for the mixture. So we did that using a Xenopus assay. The nice thing about that was the OECD guidelines gave us a benchmark response that then we could find a benchmark dose for and use that to help us figure out what we meant by similarity. So there's some details there. But at the end of the day, when we did that, we were able to test, first of all, 4 women who are sufficiently similar to that reference mixture. Then we can evaluate their points of departure, right? Yes, relative to the point of departure. It turned out the benchmark dose, now this mixture was based on the geometric mean of exposures to these pregnant women, right? So 1x is a geometric mean, right in the middle of the exposure distribution. We're estimating a point of departure at 8x. That's not that much higher, right? Sorry, that was the lower confidence limit, but the confidence limit, the estimate itself was 14x. When we did this then, finding only the women that are sufficiently similar, then we can estimate a similar mixture risk indicator, SMRI, and you see the distribution there on the right. And it turns out, again, just like a hazard quotient, you might use a value of 1 as saying, well, that's too high. And in this case, it was like half the women had values greater than that. I've recently started an analysis of NHANES data in the United States with this same mixture in. And in the United States, with sampling weights, now this numbers might not be finalized yet, but it's like 70% of women in the United States. That's hundreds of millions of people, right? Sorry, it's not 100 millions. I don't know the number. It's big. And then the number that's greater than 1, it was like tens of thousands of people, right, of women of reproductive age. So you might think, oh, that's just a mixture in Sweden. There are a lot of women in the United States, much bigger, that are also exposed sufficiently similar to that mixture in. So maybe we can construct a bunch of these mixtures, right, and evaluate them. Okay, so my summary and final thoughts. So I think these metrics are things that could be used more often in risk evaluation. Humans are exposed to these things. There are all kinds of biomonitoring studies around the world that we can use to demonstrate these different metrics. Maybe we need to start publishing these weights and things so that people can construct their own weights with these things. The My Nutrition Index stands true to do what we might think it should do, but even in the world of toxicity, right, you're exposed to all these chemicals, eating better can still be a good public health message. And I think maybe this step towards causality might be a way that we can use to evaluate through counterfactuals the WQS and what it means. And finally, the ACR and the SMAC are ways where we can use empirical evidence of things to support what's being used maybe in other assays as well. So bottom line is, I hope that you can consider the idea of, if we're going to do biomonitoring studies and cohort studies in humans, let's use it in terms of evaluating risk in human relevant mixtures. So thank you very much. I'm happy to address questions. Forgot to acknowledge my colleagues. Sorry, there they are.
Thanks a lot, Chris. This was really, really stimulating, and I think I think a lot of us are aware of the recent paper, and it certainly
the science paper.
Yeah, caught a lot of attention here around in also in the regulatory world. I think there's a lot of food for thought, and also thinking about how we can implement it in a regulatory context. This is what we need to think hard about at the moment. So, Bruno, I'm looking at you, and I hope also that the audience here found the talk stimulating. And I see that we have the first question coming in. So I'll just jump into the Q&A session now, Chris. We have around 10 minutes, and then we move to the pitch talks. So I have the first question from David Gott. Chris Gennings, how do you allow for exposure from birth to year 7 in your assessment that allows you to be convinced it is a prenatal effect?
Okay, well, the exposures were measured prenatally. For 7 years, we do have to have confounding in the model and having, adjusting for covariates and things. But I guess the point is, well, two things. The point is that, you could evaluate continuously over time. We don't have those data at 7 years, or they haven't been evaluated yet. But the other thing is, so you might say, well, it doesn't really matter. It doesn't really measure what we think it is. But that was one advantage of the SMAC analysis with the EDC mixed risk or that strategy in general, is to say, well, we have this observational data and we suggested these are chemicals related to neurotoxicity. And in fact, we had experimental evidence, and that mixture was related to, mechanistic arguments about things. So, there may be limitations with observational data, but linked with the mechanistic data and things, I think we can demonstrate that there were associations and maybe more causality than we are used to claiming.
Thank you. And then we have a question more from Ron Hogenboom. How do you differentiate between persistent and non-persistent compounds?
Well, that's my chemist friends. That's not me doing that. So, yeah, yes.
Maybe they are here even. Yeah. Okay.
Like my friend who was an opera singer, she said, I'm just a singer. I can just say, I'm just a biostatistician.
Yeah. Okay.
I don't know. That can't answer that question.
No, so Ron, I think you have to approach some of the co-authors of the
yes.
paper. Yeah. Okay. Do we have more questions, Bruno? No? In that case, I think maybe if there are anybody here in the audience who would just want to pose a question here, I think we have time enough for that. It doesn't seem to be the case. Thanks a lot again, Chris. I think you really provided a lot of really interesting thoughts, and I think we have something to work on.
Good. I hope so. Thank you very much.
Yeah. Oh, there's one more. Oh, sorry. So there was one more question here. So this is from Antonio Hernandez-Jerez. What are the main limitations or uncertainties related to the WQS approach to be used for regulatory purposes?
Yeah, so when we do a weighted quantile sum analysis, we always start with single chemical analyses. So we want to look at things where you see evidence maybe from single chemicals, so you sort of start walking before you run with the whole mixture. So it's built on those kinds of evaluations as well. I don't think we should claim that we're going to have significant single chemical effects. That's the whole point of a mixture effect. You might just miss that, right? So for regulatory, it's not like we're just putting the chemicals together. We do see evidence of exposure effect, significant. And I think that the generalizability of the repeated holdout gives us a little bit more sort of support for that. You can always redo more studies, you can, you know, et cetera. But yeah, I think we need to start putting chemicals together. So there's that balance between, you know, having strong evidence based on single chemicals and things like that versus our exposures are really to higher dimensions.
We have another question from Dieter Schrenk. Chris, how do you correct for socioeconomic factors possibly affecting knowledge on nutritional needs?
Socioeconomic factors. Well, you know, that's not part of the My Nutrition Index, but I have to say we've been doing an analysis of the microbiome of some women in Wisconsin, some people in Wisconsin. So there's not a lot of diversity there, but it's 700 or 800 people. Microbiome data, My Nutrition Index, cross-sectional. But we do have evidence of food security and food insecurity, which might address that question. And, you know, we are picking up differences in the microbiome as, first of all, the distribution of the My Nutrition Index is different for those two types of situations, but also the taxonomic sort of diversity is different between those with and without food security. In fact, it's broader for people with food insecurity. So that was kind of interesting. We're about ready to submit that paper, so it's not under review yet. But so I think in terms of SES and things, I think that's going to be an external thing. The My Nutrition Index is based on nutrition. It's not based on nutrients. It's not based on, you know, what kinds of foods or things like that. It's focused on the nutrients that come from the food.
But you think that the microbiome situation or landscape, it could reflect socio-economic status to some extent.
So. Yeah, it could be different foods, types of foods, as well as stress and things. You know, it's not so clear. But yeah.
Okay, I'm looking here and I'm looking at the top. Maybe I can just allow myself for one question.
Absolutely.
I'm coming from a kind of the regulatory side. Have you had any reactions from, you know, the U.S. regulatory authorities on this so far?
On the SMAC?
Yeah.
We gave a webinar about a couple of months or so ago after the paper came out, and there was a lot of attention about it. Nothing formal from the EPA, but there were people in the audience from the EPA and who were interested in looking more into it. So I hope it can get some traction. I think would be really cool because those metrics can be evaluated. Like I say, we had the mixture in. You can evaluate it anywhere. I mean, and so that's what we need to start doing, and people can evaluate their own cohorts and their own biomonitoring studies with that. So, and maybe we need more mixture ins or mixture, you know, all kinds of different mixtures. The infrastructure that we could put together that would evaluate that over time and space would be really interesting, I think.
Yeah. Thanks a lot, Chris. And just an applause for Chris.
Thank you.
So now we move to part 2 of this session here. And here we will have 5 pitch talks. So during this session, we will not, the app will not be open for questions. This is something that we will have polls afterwards, and we will have a plenary discussion based on these pitch talks. But during this session here, we will not have questions and answers. So we have 5 speakers here. 4 are in the room, and 1 is offline or online, off stage. And I think I would just want to ask the speakers to go on stage and sit in the armchairs. No, we don't. No? No? Okay. So we have these the 5 talks here, and I'm just going to give the first speaker the floor. Let me see, and this is Peter Korytar from DG Environment, and yeah, please, Peter, the floor is yours. Yeah, there was a mistake here.
Thank you, and good afternoon to all. And thank you very much, and it's my pleasure to be here and to give you an idea or to explain the EU chemical strategy for sustainability and part on the chemical mixtures which we have in. It's also worthy to thank to our colleague from EFSA for this personal challenge to make this as a pitch talk, which is really a challenge for the policy officers. We are used to with a lot of slides and reading them through. So this is our attempt to entertain you and make the message right and still understandable. So I would like to start with explaining the basic vocabulary. So the chemicals occur as individual mixtures, as intentional mixtures, as non-intentional mixtures. So what do we mean by individual chemicals? I think it's for majority of you quite clear. It's a chemical. It can be a hexane, as on the picture, in a bottle used for gas chromatography or whatever purpose. Any other chemicals, individuals, are, of course, similar. Either they are bottle or something like that. Then we have intentional mixtures, which are the mixtures composing of many components put together for a particular purpose. So there are many products of our everyday life, which are those. Cosmetics, detergents, paints, glues, and so on. And then we have unintentional mixtures, and those are the mixtures which are inside of me, inside of you, or they are inside of rivers. So there are actually chemicals that comes together from different sources, from different uses. As we go through the day, we get them in, and they stay and interact somehow together. So I would like to then continue with the a knowledge or a state of knowledge based on which we made the chemical strategy and based on which we actually make those proposals in the chemical strategy. So first is that exposure of humans and the environment to unintentional mixtures is the norm. It's not an exception. It does happen. It does happen all the time. And I think the opposite is true, that it is exception if it would not happen. Second point is that there is evidence of impacts of unintentional mixtures on human health and the environment. And this evidence was clear already 20 years ago for the environment. We have a scientific committee's opinions. It was very clearly documented in the real life studies from the water bodies and so on. And for human health, of course, the causal links is always more difficult, but the progress is moving forward, and we are getting more and more studies coming in. So we have enough evidence to conclude that there is a problem with unintentional mixtures. Then I would like to, another thing what we have learned about the unintentional mixtures is that the risk and impact of unintentional mixtures exceeds the risk of each individual mixture component. So even for chemicals which are present in our bodies or in the environment below the safe levels, if we put them together, they can cause an effect. And then finally, it's a concentration addition is a suitable concept for assessing the joint action of mixtures. It might a little bit overestimate the potential risk, but when you look on the studies that were published, the overestimation is not so huge, and it's a good conservative approach for the regulation if we are aiming to address or ensure the safety for humans and for the environment. Another finding which we have is that when we look on the unintentional mixtures present in humans or the environment, and we look at their risk quotient and order them in order of magnitude of the value for that, we always find a distribution which is very similar to this one. It's always the overall mixture impact or risk is driven by few chemicals. In principle, a Pareto principle could apply that 80% of toxicity comes from 20% of chemicals. When you look on the mixtures which are very rich, has a very high number of components, whether low components or whether you look at the environment and humans, the distribution is more or less the same. Some chemical mixtures has the components at the beginning which are over 1, which means they are basically not safe as individuals. But even if you look on the mixtures which are all below 1, the distribution is still the same. So let's have a look on the regulatory requirements, what we have in the EU. As you may know, we have a very comprehensive legislative framework to ensure safety of humans and the environment. We have a lot of different pieces of legislation on consumers, on chemicals, on workers, and they are very good, or they are good in addressing individual chemicals and intentional mixtures. They are, of course, in the strategy there are other actions calling for improvements of the addressment, and that's true, but from the perspective of overall protection from individual chemicals and intentional mixtures, this legislation is well in place and addressing those concerns. However, our legislation is not adequately equipped to address unintentional mixtures. And there are also the requirements in the legislation not present actually calling for such an assessment. And those, I think we have currently only one piece of legislation, which is a worker protection legislation, which requires employers to ensure that chemicals present in the workplace are taken into account together. And then we have some, we have plant protection product regulation, biocidal product regulation, and maximum residue level regulation, which calls for cumulative and synergistic assessment, or take into account cumulative and synergistic effects, which leads to assessments usually of those within that field, so pesticides together, biocides together, and those which are present in food. Consequently, in the chemical strategy, the Commission proposes that we need legal provisions to take account of unintentional mixtures, and in particularly in legislation like REACH, cosmetics, toys, food contact materials, food additives, detergents. And now, it's not so easy, that we know, and that's why it hasn't happened so far. And there are clear challenges in such a regulation. So what are those challenges? Is that we have to regulate known unknowns. And the problem of what are those known unknowns is that this composition of these unintentional mixtures is unknown and varies. It goes from mixture to mixture, is individual, basically. The substances driving the risk are varied. We've seen the distribution of the risk, but those chemicals which drive the risk are different from mixture to mixture. So it's not enough to address those first 3-5 chemicals like it would come into mind. And then finally, there is a lack of information on toxicity of individual components. Also, we have, for some chemicals, we have a quite rich information, but there is plenty of chemicals which we don't have sufficient information. So the chemical strategy, or the Commission in the chemical strategy, proposes that there is a need for a pragmatic and workable solution, and such as mixture assessment factor. And that mixture assessment factor as such is the most pertinent for REACH, especially in the registration situations, because there is really no information available for registrants to know what other chemicals will come together to do their chemicals, and for them to ensure the safety of that chemical, there is no other means. And then further, to continue developing other methodologies to make it more tailored, to make it more specific and targeted. And that's it.
So, Peter, please just stay here. So I'm going to ask Peter for a keyword, and I'm going to do that for the other speakers too. Just one keyword that kind of captures the whole talk. And based on the keywords that we collect from the speakers, this is what we are going to poll you about a bit later. So, so Peter, if you're reflecting on your talk here, what keyword would you suggest?
I would suggest known unknowns, or regulating known unknowns.
Thank you. Yeah. So that's certainly ambitious. Yeah. Thanks a lot, Peter. Then I would like to invite our next speaker, Almut Bitterhof, to come to the stage. Thank you. So Almut, she is currently the deputy head of unit in the unit of pesticides and biocides in the Directorate General for Health, DG Santé, and they are dealing in particular with issues related to pesticides residues in food and feed. So please, Almut, the floor is yours.
Yes, thank you very much, Suzanne, for the nice introduction. And I also have to say that I'm extremely happy to be here today after 2 years of talking to my screen in several conferences. I'm really glad to have some real auditory in front of me. Now, so I also try to deliver a pitch talk. As my colleague said, this is a little bit of a challenge, but yeah, we will see. So when I looked into the presentation and how I would start with it, I decided that I would start with the notion of chemicals. As you can see on my slide, of course, chemicals, they are part of our lives and they are also part of our bodies already. Actually, humans have always been exposed to them. Of course, with development of modern medicine, it has become more obvious that we can have chronic effects from chemicals, which previously was not so clear because people simply didn't live that long. And it's sometimes provoking some fears among us, and we are looking for answers. Questions that we get is what happens with these chemicals interacting with each other, and what happens when these chemicals are interacting with our bodies, basically. But of course, you see from the slide that we need chemicals, and chemicals are actually very beneficial to our whole lifestyle. We want to have certain food texture, flavors that we expect. We want to have functional kitchenware. And we want also to have our crops and soils to remain healthy. So in such a world of complex combined effect, it just seems outdated today to look at substances one by one. And I believe we do need some better models. Now, on this slide, I would like to say that we have, as Peter has also said, we have very strict regulations in the EU on chemicals already. The REACH is the overarching piece of legislation. But then we have also sectoral legislation, very strict and very good ones. They are very well performing, but they have an important shortcoming. Actually, when they were drawn up independently from each other, and they are not really interrelated. So while they ensure a very good and high standard in their areas, there is a lack of consistency between all those pieces of legislation. And this is why I believe we do need to break those silos, the ones you see on my slide, and to find a more cross-sectorial approach. Now, just a quick word on the chemical strategy, because Peter has mentioned it. The chemical strategy actually recognizes that for the moment it is not realistic and also not economically feasible to assess and to regulate an almost infinite number of combinations of chemicals. Therefore, it has proposed a mixture assessment factor as a pragmatic approach to deal with those situations. But at the same time, it also enables us to use more targeted methodologies where we have and where we need them. Here, I have put an example of a specific area where, for the moment, we already have cumulative risk assessment integrated in our legislation. It's the area of pesticides. I will try to use this beamer. No, that doesn't work. Anyway, what you see in the circle are the main 3 regulations that we have that are actually covering the fate of an active substances from its approval in 1107-2009 to its marketing and use in the Directive 2009-128, over a legislation on maximum residue levels, which is the 396/2005. You see in these broken arrows that 2 of them already have requirements that we should apply cumulative risk assessment when the methodology to do so becomes available. But, well, you see here it's a big question mark, because what does this mean actually, and how would we do this? Basically, the policy asks us a quite important but also very difficult questions. So what happens if you have multiple chemicals in a food? What would be the effects on health? Or asked the other way around, if you know you have health effects from a combined exposure to several chemicals, how would you regulate those substances? And what happens if for this particular effect you already have approved substances? What will you do with new approvals, new authorizations? So all of this is very difficult, and this is why we have currently very hard work ongoing jointly by the Commission, by the European Food Safety Authority, but also our member states to address all those questions. And when doing so, we also make sure that what we do is based on robust science. So the EFSA, and you can see it here on my slide, I can't use the pointer, it's the first bullet point, has actually developed a methodology where they are grouping substances with similar toxicological properties. They call it cumulative assessment groups, CAGs, and some of those are already finalized. For others, work is still ongoing. So you might now wonder whether there are better or quicker ways of getting this done. And I guess I would believe, yes, there could be, but actually we also want to make sure that exposure is assessed as accurately as possible. So in the area of pesticides, we have very many and very complete data and the tools to go for a more specific methodology. This is not the case in many other areas. So is it then all perfect? No, it's definitely not perfect yet, and there is still a long way to go. But I believe we can get there step by step, but we need to work jointly together. Commission, member states, EFSA, but also our stakeholders. They are really important to be mentioned. So where do we stand today? Today, EFSA is already able to consider effects on the thyroid and the nervous system when they assess the monitoring data that are collected every year from the member states. We call it retrospective assessment of monitoring data. What we are still working on is the second part on my slide, the prospective assessment, which means that we are trying to develop a methodology to also implement cumulative risk assessment into regulatory decision-making, such as, for instance, setting maximum residue levels, or at a later stage, approval or renewals of substances and authorizations of plant protection products. Now, I talked a lot about pesticide residues in food, but of course we know that there are also other chemicals in our food and that there are many other routes of exposure. You see here that we also have air, we are breathing air, we are having cosmetics applied to our skin. And I have to tell you that for those combined dietary and non-dietary effects and all those exposure routes, we do not have a methodology yet. So there is a lot of more work to do. But is it actually possible to evaluate all sorts of chemicals together? Well, no, at least it is not yet possible now. But of course, we can try our best to get to a better understanding. And in the meantime, we can use assumptions, and this is what we're currently doing. And of course, we must ensure that also in the meantime, we ensure best possible protection of our consumers. Whatever method we are choosing, we must base it on science and evidence, though. Why is this so important? if we want to implement a methodology into the legislation and the regulatory practice, we must be able to justify our actions. So, for instance, in the area of pesticide residues, we must, of course, ensure a high level of consumer protection, but we also have to provide legal certainty to food business operators. We have to take care about international trade. This is one of the objectives of our legislation. And of course, we need to stay in touch with international developments ongoing in OECD or in Codex Alimentarius. This is my last slide, crystal ball, to ask what will the future bring. Of course, this is a good question, and we believe it will be challenging, our future. But I think we will be able to take these challenges step by step and working all together. Definitely, a combined exposure assessment will play a key role in future evaluations. And I believe we can combine specific methodologies, such as the one that we have, for instance, in the area of pesticides, with other more pragmatic approaches. They could complement each other. And using both, they can both be very relevant and useful to ensure our main goal, that is to protect as good as possible our consumers. So with this, I would like to close, and I thank you for your attention.
Thank you, Almut. So did you reflect on a keyword too?
Yes, I think my presentation would be reflected by fit for purpose.
Yeah, okay. Thank you a lot, Almut. So now I invite our next speaker, and she is not in the room, so we need her to appear on the screen. And this is Professor Christina Rudén from the Department of Environmental Science, Stockholm University in Sweden. She's a professor in regulatory toxicology and ecotoxicology. And her research really, and there's a number of very, I dare to say, sentinel papers on how, on analyzing and evaluating the foundations and workings of the EU chemicals legislation, and how we use science in regulatory decision making. So really, a warm welcome to you, Christina, and the floor is yours. Please.
Okay, thank you very much for that kind introduction. And thank you for giving me the opportunity to participate, and in particular participating online. We have a total chaos here in Sweden with a backlog of producing new passports. So it was in fact impossible for me to get a new passport. Let's see now. I can't see my slides. Okay, I'm trying. When I try to take control, nothing happens. No, maybe. So, do you still hear me? Good. Okay, thank you. As we have heard, most chemicals in EU regulation are risk assessed one by one. So risk assessment starts by defining a safe dose that humans can be exposed to without harm. And that dose is based on data from toxicity testing, often from animal experiments. The amount of data that would be available for different chemicals would vary a lot. So for some types of chemicals like pesticides and of course pharmaceuticals, we have a lot of information. But for others, we have much less and even no data for low volume industrial chemicals, for instance. But we use those data, a safe dose from an animal test, we apply assessment factors to them to come to an estimated safe dose for humans. And the assessment factors currently used, they are used to take variability in sensitivity into account. So account for the fact that the humans might be more sensitive than the experimental animals, and also that there are extra sensitive humans. So they are not designed to take mixtures into account. And in the risk assessment, we then try to, something strange going on here. Okay, and it doesn't really work. I hope you can read these gray text. They are supposed to turn black, but they don't. I don't know why. In risk assessment, the estimated or measured exposures is then compared to the safe dose. And in a REACH risk assessment and in general, you're allowed to expose people all the way up to the safe dose. So this means that it's based on an assumption that every little chemical is allowed to be emitted all the way up to the exposure that is considered safe. So it's assumed that it's emitted into its own pristine environment where no other chemicals are allowed to be present. What a MUF will do is to say that a MUF of 10 would say that the one chemical is only allowed to be filled in this risk hub up to 10%. So a MUF of 10 would actually make room for other chemicals also to be emitted into the environment and give space all the way up to the safe dose. So we like to even call the MUF not an assessment factor, but an allocation factor. So there is a lot of science, and we have heard about it already, that mixtures actually matters. And so we have a system right now that actually systematically underestimates risk. So it's a risky approach. And the safe exposure levels that we have defined for single chemicals will in many cases not be sufficiently protective. And it will also not be sufficient to take to reduce the highest exposures to make sure that every single chemical is below its regulatory reference value. So we really need to develop the system to take mixtures into account. When we talk about chemicals, we usually think about a lab, but in fact, we can see consumer products as also containers of chemicals. So the flow of consumer articles in the technosphere is indeed a flow of chemicals. However, there are no requirements to tell us or to provide information about what chemicals that these consumer products contain or information about what they emit. So they give rise to unintentional mixtures, and we really don't know very much about the contents or the compositions of these mixtures. And of course, a part of the reason or the challenges here is that these materials and consumer products are produced in very complex and long supply chains sometimes, so it's difficult to know exactly what they contain. We've also seen that these chemicals and the different consumer articles are regulated by many different EU rules and also national rules. And very few of these take unintentional mixtures into account. There are a few exceptions, like were mentioned, the occupational exposure and for maximum residue levels of pesticides. And indeed, what EFSA is doing with the CAGs is very, very interesting and a very welcome development, but it's also dependent on data-rich chemicals. So it requires a lot of information about the chemicals to actually be able to group them into CAGs in that way. And for rich chemicals, we typically don't have that kind of information. Another shortcoming, if you like, is also, of course, that it only covers pesticides or plant protection products, and it does not take into account exposure from other types of chemicals. And indeed, we do not have any overarching framework right now to combine information from these different legislation and actually take real life exposure into account. Okay, I'm sorry that this doesn't work. You see this gray text, and I hope you can read it, even though that's gray. It's supposed to change colors into black, but that is not working for me right now. So to conclude this, the unintentional mixtures that we are exposed to in real life, they are poorly characterized. The number of potential mixtures is almost infinite, and even more importantly, they change in time and in space. So it's not enough just to characterize them once. We need to continuously monitoring them. So that means that case-by-case solutions to this mixture problem is not possible. So therefore, the mixture assessment factor is a compelling solution. Introducing a MAF will increase the relevance of the risk assessments. It will move away from the risky approach that we have right now. Given the uncertainty, variability, and complexity of this system, I see it as the only feasible way to manage these mixture risks. And it has also the advantage that it can be applied within the system for single chemicals. So therefore, I think the MAF is a pragmatic and science-based approach to manage these mixture risks. Thank you.
Thank you, Christina, on this for this talk on the mixture assessment factor. I'm sure we will come back to that later during this session. Do you have a keyword too that you would like to share?
Yeah, it was said that we were allowed to give two, so I proposed uncertainty and variability.
Thank you, Christina. Okay, so now we have the next pitch talk. There we have Paul Price from the US. He has decades of experience within the regulatory arena, in industry, and he's worked a number of years within mixtures risk assessment. And he's going to reflect a bit on the possibilities of assessing multiple chemicals across regulatory domains through tiered approaches. So please, Paul.
Thank you very much for the introduction. Good afternoon. I'm speaking today about the critical role that exposure science can play in trying to meet the challenge of the unintentional mixtures. I think, good, it did work. Let me first quickly put out a caveat. A lot of the work I'm going to be presenting today was performed at the Environmental Protection Agency. However, I have retired from EPA. I did not get their clearance for this, and they have no knowledge as to what I'm going to say. Thank you. I will present two specific ways that exposure science can help address the challenges from unintentional mixtures. The first way is advances in the field of exposure science enable us, I believe, to directly characterize the doses and the pattern of the doses across individuals that come from unintended mixtures. Over the past 7 years, I've had the privilege of working with a team of exposure scientists at US EPA who have done some truly amazing work on the area of exposures for unintentional mixtures. So as previous speakers have indicated, unintended exposures to these unintended mixtures are indeed complex. And as some of them have pointed out, one of the components of the unintended mixtures is exposure from the use of consumer products. So I'm going to be talking today about some of the advances in the field of assessing mixtures of combined exposures from consumer products. Consumer products are a very important issue, even though they were one of the sources. They actually generate much higher doses in general than environmental sources of contaminants for most chemicals. They also represent the largest number of independent chemicals and how they get to people, because we have very complex products, so we use lots of them. And also individuals, almost everyone uses a consumer product, so everyone is exposed to one or more chemicals from them. In this slide, I'm presenting a tiered approach as to the steps you would have to go through in order to estimate the exposure portions of combined exposure. So first you'd start with all chemicals in commerce. Then you would just look at the chemicals that are in consumer products and set aside the ones that are only used as site-limited intermediates. You would then have to look at the demographic or the population you're interested in and say, what products do they use? And then what are the chemicals that are in those products? And then once you had determined that, you could then use some of the existing models to estimate the doses for each of the chemicals in each of the products. And I'm thinking of models like Consexpo or some other models that have been developed in the US. Once you have those doses, you could do a tiering and exclude chemicals that were there at such low doses you really don't care about them. And that happens for a lot of chemicals. But now you have your sets of doses of the chemicals, and you need to evaluate how will they cross the exposure barrier and how will they result in internal doses. So you need PBPK models. This all sounds quite difficult, if not impossible, and I'm here to tell you is that every one of these steps has an active research program inside of the Environmental Protection Agency, and there are publications and there are tools to achieve all of them. Some of the things that the agency are doing, and I only have a few minutes, so I can only touch on these, is they're developing databases of personal characteristics which can be used to predict the probability of using a particular type of product. I have a 14-month-old grandson. We buy diapers. 2 years ago, we didn't buy diapers. So those type of patterns can be captured with information on the demographics. They have information on the composition, which has been done by scraping the internet for data on the composition of formulations from material safety data sheets and from lists of ingredients. They have developed generic models for different types of consumer products, which facilitates rapid estimate of exposure. And they have a high throughput PBPK model, which allows the determination of internal doses. So with all of that work, they are actually starting to generate some preliminary estimates of combined exposures that will result from an individual's use of a wide range of consumer products. So that is my message of hope. There's some light on the horizon. There's some people doing very interesting things that Europe needs to pay attention to and take advantage of in trying to build this. And it's maybe with multiple years, you will find it's feasible to actually start achieving some preliminary estimates. The second area I wanted to talk about is how a statistical analysis of exposure patterns can help determine the size of the mixture assessment or mixture allocation factor. Many of you will remember that about 12 years ago, I and a number of other researchers did work on the relative contribution of individual chemicals to the adverse effects of a mixture. And we developed a metric called the, hang on a second, get it on the right page, the mixture, to evaluate the contributions from it, and particularly to determine what's the relationship of the largest contribution from any one chemical to the total dose, the total risk posed by the mixture. And this was an important issue because essentially what we're determining there is the size of the mixture adjustment factor that an individual needs. And the MCR was based on the idea that everyone's exposures are unique, so everyone has their own MCR, but you can look at the distribution of MCRs across the population, and based upon that, you can determine what is the mixture adjustment factor that would be necessary to protect a certain fraction of the population. So here is a printout of results from a publication where we examined 6 phthalates using the NHANES biomonitoring data. And I have to apologize for the label on the x-axis. This is what happens when you prepare your slides late at night and you allow a cat on your keyboard. But what the chart is essentially telling you is that if you are looking to protect the typical individual, you needed a mixture adjustment factor of around 2 to 2.5. But if you were trying to protect the person who has the highest exposures, and this is the highest combined exposure, so it would be the largest hazard indices, the size of the MAF is smaller and actually approaches 1 in many instances. This pattern occurs constantly across all the mixtures that I have investigated, and it appears to be related to the fact that the patterns of exposures that people receive tend to follow log normal distributions, and right-skewed distributions will always generate these types of patterns, where the fraction contributed by the largest component increases with the size of the total cumulative risk. So that's one phenomenon I wanted to put in front of you, saying that if you have a regulatory program that is focused on protecting the 95th percentile, you may not need as large a mixture adjustment factor as you have one that is focused on protecting the typical individual. The second phenomenon that I wanted to share today comes from an analysis that we did of simulation of population exposures to chemicals. So we generated 100,000 populations varying the geometric means and the geometric standard deviations of each of the sources of chemicals for the population, and then calculated the individual doses and determined the MCR values. And what we found was that we generated huge clouds of MCR values, but when we plotted the MCR values against the geometric standard deviation for the chemical sources, what we see was a dramatic decrease in the size of the mixture adjustment factor was necessary to protect the population. And the geometric standard deviation is a measure of how close together are people's doses. So if you're all exposed to one source, do you get the same dose, or do you get a widely ranging doses? And if you're dealing with pharmaceuticals, the doses are very narrow because we all take the same size pills, and they only vary because of our body weight. But if you're looking at drinking water or environmental sources, or if you're looking at consumer products, they vary because we vary in what products we use, and how much we use, and how much concentrations are in each one of them. So you get lots of variation in the doses. And the analysis showed us is that when you start having geometric standard deviations of 5, 7, and above, the size of the mixture adjustment factor necessary to protect the people who are most exposed becomes rather small. So, in conclusion, I hope I've given you a couple of very interesting teasers here. I did not have the time to go through them in detail, but I believe that exposure science can directly help with the challenge of unintended mixtures by both giving you the tools to characterize them in hopefully useful and representative ways to deal with the complexity that they pose, and also that a careful analysis of the patterns of exposures may give us insights as to when and where mixture adjustment factors are most needed. Thank you.
Thanks a lot, Paul. And a key word from your side.
Exposure science.
Exposure science, yes. Okay, so now I invite our last speaker for this part of the session. And here we have Dr. Philip Marx-Stoelting. He will tell us about risk assessment of combined exposure to multiple chemicals, case studies in food safety. And Philip, he is working at the German Federal Institute for Risk Assessment, BFR. He's done that for a number of years, and currently he's head of unit of the testing and assessment strategies of pesticides. So there he also works, of course, with pesticides, but also a lot with endocrine disruptors. So please, Philip, the floor is yours.
Thank you. Thanks, Susanne, for your kind introduction, and thanks for inviting me. As Susanne said, I'm Philip Marx-Stoelting. I work at the Federal Institute for Risk Assessment, and as you may have guessed from the name, we do risk assessment of chemical substances. And what we have done in the past, you can see that over here, we have looked at substances individually. We have done hazard assessment, substance by substance, exposure assessment, and ultimately risk assessment. You see different color codes for substances, and I didn't want to draw formulas, so you'll see letters here. They represent that we have also worked in regulatory silos. Some of you have already been referring to that. We looked at biocide active compounds, pesticide active compounds, REACH chemicals, contaminants, and so on. But what we are aiming at in the future is to look at overarching groups and to do hazard assessment as well as exposure assessment in an overarching manner. Why is that? Because we and many of you have been working on mixture toxicity in the past and have found that if we have two of these substances, A and B, affecting the same target organ via a similar receptor, a similar mode of action, they do not behave independently, but they behave according to the dose or concentration addition model. Hence, they stack, and we have to deal with that. It's not like, as in this example here, with dissimilar action, where we have substances, one is affecting the liver, the other one the kidney, and they act distinctly. And fortunately, and that's the last part here, it's also not what we rarely observe, that chemicals influence each other. They influence each other's kinetics. They influence different pathways, so that in the end we have interaction like antagonism or synergism. In my talk, I would like to differentiate between data-rich and data-poor substances. Data-rich substances have a comprehensive set of hazard data as well as a comprehensive set of exposure data. Examples are active substances that will be used in pesticides or biocides or high production volume REACH chemicals. For this, I would like to propose to continue with a CAC proposal that Almut has been referring to before. But then there are also data-poor substances, where we have limited data on hazard and limited data on exposure. Many contaminants fall among this, but also low production volume chemicals under REACH. And as I see the chair of the Contem panel in this room, of course there are a lot of contaminants where we also know quite a bit about. So this will be the second part to refer how to proceed with these. But first, how to proceed with data-rich substances. What EFSA has been done, and member states have been working on this as well, is to group substances according to their hazard. You see, we know based on the data that we have for the data-rich substances, the target organs. In many cases, we also know or have information on the mechanism and sort them into so-called cumulative assessment groups. For example, affecting the nervous system or substances affecting the thyroid. This work will be extended as many substances, for example, affect the kidney or the liver. Next steps would be to look at this. And then we also have exposure data. We have monitoring data, not only from France or Germany, but from the whole EU, from all countries, for all different sorts of fruits and foods. And we also have food baskets. We know what the people eat, different groups of the population, including sensitive groups of the population, like toddlers, for example. So we have used this and have done the following exercises. The occupational, the occurrence data, as well as the consumption data, have been modeled by a Monte Carlo risk assessment with 100,000 iterations. We had an exposure distribution coming out of that and compared that to a margin of exposure in total, MOET distribution. The margin of exposure, in brief, is the tox reference dose divided by the exposure. So whenever that's high, then you are on the safe side. We did an uncertainty analysis, and ultimately it came out that cumulative exposure to pesticides with chronic or acute effects on the thyroid or the nervous system do not exceed the threshold for regulatory concern. So here, data-driven mixture risk assessment was successfully applied. And if we take the beaker that we had in the beginning and look at the reference dose marked in red, even under condition of combined exposure of more than 100 substances, we were still at the safe side. So you are all safe. That's the good message from that. But now how to proceed for data-poor substances. And I would like to refer to one of my original figures that's taken from a standard textbook, and you may all have heard the sentence, that all standard textbooks are essentially wrong. I tell that my students, and it's a bit annoying because I'm the author of that chapter, but I have to admit here that is of course wrong. Sorry, because the substances do not affect the liver first and then the receptor, but it's the other way around. That we put the liver first is that as toxicologists, in a classical way, we look at the target organs first and the target tissue and the histopathology. But in fact, what happens in biology is that the receptor is affected, the molecular event, and then there is a series of key events that ultimately lead to the adverse outcome. And those of you working in toxicology will, of course, have recognized that this is the adverse outcome pathway concept that's behind, with the molecular initiating events, the key events, and then the adverse outcome. And the good news is that we can look at these molecular initiating events in vitro, and that has been done for a number of contaminants, for example. For dioxins, we know that the AH receptor is important, and we could derive relative potency factors to group substances and make group risk assessment. So the proposal here is to group substances according to structure and then derive relative potency factors for relevant AOPs for their MEEs or late key events and calculate combined hazard-based on RPFs. For some substances, this has already been applied successfully. And what we do propose, and that's a recent Nature Food article by our group, is that we apply that for many substances, not only in a retrospective, but also in a prospective manner, by taking into account exposome data. That we go away from the classical animal testing, make use of the different AOPs that are affected by chemical substances, screen in vitro, and correlate what we screen with exposome data generated from European projects. So data-driven mixture risk assessment can be applied by combining new approach methods and exposome data. When you are in a situation where you don't know which way to go, it's always good to have a roadmap. I know that today we of course have satellite navigation, but ultimately in each satellite navigation there is also roadmaps behind. You may remember parts of this figure from my beginning, the past and what we would like to achieve in the future, and that there are roads, one for the exposure and one for the hazard part. And what you also note is that I indicated a lot of gaps in these roads. The question is how to address them, how to proceed. And here we are quite fortunate that in Europe we have a number of projects completed, like Euromix that was coordinated by Jacob van Klaveren sitting over here, but also projects like HBM4U, EDC Mix Risk, or ongoing projects, Panoramics, where BFR is also a partner in. And then there are upcoming projects. One, a big initiative called PARC, Partnership on Risk Assessment from Chemical, has just been started. In that activity, I'm leading the tox part together with a colleague from ANSYS, and Jacob will be leading mixture assessments. EFSA will be announcing a number of projects, and these projects will ultimately help to close the gaps, to go all the way from what I said is the past to the future. I think we are already on that way, and I invite you to follow us to that path, so that in the end, data-driven approaches make additional uncertainty factors unnecessary. And with this, I would like to thank you. And Susanne, my keyword,
Yeah, please.
you may guess that, but it's data-driven.
Thank you. Thanks a lot, Philip, for this last stimulating talk. So, so we are approaching a coffee break. I think during this first part of this session, now you've heard about the ambitions behind the chemical strategy and what DG Environment, their ambitions are. Also, DG Santé has reflected on what the methodologies that we are using now and what might be needed in the future. We've heard about the mixture assessment factor, the possibility of tiered approaches, and lastly, by Philip, how would we also, what possibilities do we have in terms of data-driven approaches? And we hope that this has served as a good plate of food for thought for the next part of this session after the coffee break, where we will have a moderated panel discussion. I certainly hope you will be with us for that part too. I think I don't have more to announce now. I'm just looking to Bruno. We are scheduling the coffee break until 4:05, and I invite you to be back a few minutes before so we can start timely. Thank you all, and thanks to the speakers. Thank you. So, and thank you for being back here. We're still a lot of people in the room here, and I hope also you attending remotely that you are ready now and you had a good coffee break. So we move on to our next session here, and this is the moderated panel discussion. So again, I just want to remind you about that the interaction will be through the app again. So this will be questions for the speakers, and also we have the two polls that our moderator also will introduce a bit later. But before we start, I just want to introduce our moderator, and I just have to find the right page here. So this is Dick Syme. I think I pronounced it right.
Thank you.
I hope. And Dick, he's heading the unit of risk assessment at the Office of Risk Assessment and Research at the Netherlands Food and Consumer Product Safety Authority. And before he did that, he has a really an impressive curriculum in regulatory, the regulatory arena. Please, Dick, the floor is yours.
Thank you, Suzanne. And thank you all for joining us again, or being here, staying here for this most interesting and most rememberable meeting session of this conference. Because today, the 22nd of June of 2022, the start of removing all the silos and getting it to one assessment for mixtures will start. So thank you for joining that. Just some household messages. We will start a poll during my introduction talk. Hopefully the poll will start online on your app. You can start with this sort of popularity vote, because you will choose the one of the keywords that the presenters, the pitches delivered just now. So you can vote on that, and the keyword that got the most votes, that will be picked up by me, and the questions will be raised. What will the winner get? The winner will get his question posed onto the panelists. So that is the prize. Let me invite the panelists to come to the stage. So Peter, Almut, Paul, you have been introduced, but you will now be on the spot. Because now you will be challenged, and Christina will appear soon. But before that, I will show you a couple of slides, and I hope the slides will come up now. So do I need to push? Click. I need to click. Okay. So this is a summary of what we've learned earlier. There is a complex landscape of legislation on the use of chemicals, or the production, the introduction to the market. We have several pieces of legislation for on REACH, for production, for use, for pesticides, biocides, food contact materials, and it seems complicated. But after all, it's only a handful of pieces of legislation. So there's not hundreds of thousands of silos, there's only a dozen of them or so. So that is manageable, I think. So that's the first slide I would like to see. The second slide I would like to see is something that happened to me almost 20 years ago. And that was the time that the EU Commissioner for Environment, Wallström, had her blood analyzed. And I must confess, I was trained as a scientist. So I looked at the results, and the results showed that there was PCBs in it, and dioxins, and legacy pesticides. And I said, yes, of course. No surprise to me. I was trained as an environmental risk assessor, and you know that chemicals come across the environment and get into your blood. But Wallström was a politician. Unfortunately, politicians are not scientists. And she used this to convince other politicians that REACH need to be there, the REACH regulation. And we are, again, at such a sort of cross point, I think. And later on, other groups didn't like to have all types of mixtures of chemicals in their house or in their environment. And I particularly liked one group of consumers, and that was this group, the vampires. They wanted to have clean food, and they supported the appearance of REACH. We are now again at this crossroad, now not to regulate single chemicals, but mixtures of chemicals. And that is our task today. So getting a sort of roadmap from the science. You've seen lots of science from the pitches. And can we get one sort of approach that deals with all these silos, all this different legislation, and get somewhere? So that is the quest and the challenge today, and in particular for our panelists. So beware and be ready for that. So thank you for this introduction, and these are all these words that came out from the pitches you heard before, the wonderful pitches. So up to the poll, I think. Can I just move on clicking or no? Then I need, I think, to see Christina on the screen. Yes, hello, Christina. Can you turn on your mic? Yeah, okay, nice to see you again, and back in this panel, in the middle, so you're the most important one. And the biggest one. Now I'm seeking for the outcome of the poll. It is exposure science. So, Paul, you're the winner. Well, the first question would be, you showed that you have an approach to dealing or using exposure data with all types of other data. But data-driven is higher. Yes. Sorry, Paul.
I won't contest the election.
But I somehow think that these two are connected. and on data-driven, Philip, what do you already mentioned some, but what is the main lesson learned from the data-driven approach, which can contribute to deal with all these silos, with one common approach?
I think one of the key messages that if we have data, then we can calculate the exposure, we can look at the hazard, and we can do that not only for one compound, but for groups of compounds, like the CAC exercise that has been chaired by EFSA has been showing. And that entitles us to make a comprehensive risk assessment even for mixtures. I liked very much one of the slides that Almut has been showing, and that was the one where you had on the one hand the mixture assessment factor, and then on the other hand, the data. And I think whenever you can do it, whenever you have the data, and a lot of them will be generated over the next 7 years in this project called PARC, then you can avoid to have an additional uncertainty factor. And that's why data-driven was my keyword, because as a person working in toxicology and doing research, I'm of course a fan of generating data. And yeah, maybe that's to answer your question.
Well, thank you, Philip.
Shortly.
It looks like a little bit looking back on the data that you have and learn from that, and it also wait another couple of years to progress. But Almut, could you think of something that you could use tomorrow from the data-driven approach?
Do you hear me?
Yes.
Okay, thank you. Well, yeah, I think we already learn a lot from what we have right now. So we only have 2 of these cumulative assessment groups, the nervous system and the thyroid. You could say, well, this is just a little piece, but what we already see, and I think it's quite relevant information, is that basically there are certain compounds, really certain 1 or 2 substances that are driving the risk within these groups. So it doesn't mean that we shouldn't do this group assessment. I think we need to do them. But it is very useful knowledge for risk managers then that we know that basically in the end there are very few substances, and I think it was also mentioned in another pitch talk, there are only very few substances really responsible for the overall exposure and the risk. So I think this is an important lesson that we could learn, that we of course need to confirm with new cumulative assessment groups that are still to come. We don't know, maybe the outcome could be different, but I think it gives us also already some indications and gives us already maybe also some knowledge for areas where we don't have that many data.
Okay, thank you, Almut. Paul, could you comment on this also from a prospective and a retrospective point of view?
Well, as I indicated in my talk, all of the instances where we've had data on mixtures, where we know the components of the mixture reaching the individual and are able to calculate the MCR value, we find the same phenomena, which is that you will have many compounds contributing to individuals' cumulative risks for the typical individual in the population. But for the individual who has the highest hazard index, the highest exposures, it's really being driven by the fact that on top of the background level of many chemicals they're receiving, there is one source that is delivering one chemical that is highly toxic, that is being added to that background. And that's really the pattern that we see inside of data set after data set. It's not perfectly clean, but I think it's a legitimate way to recast the question of mixtures, to view them as being the sum of exposures of concern being applied to a background level, which it may involve some level of stress, but it's not clear that that background level is really driving the risk. The risk is really being driven by these driving chemicals that have driving exposures. Now, the sad problem is that they vary from instance to instances, which is the chemical and which is the source that's driving it. So you still have to go through a mixture's risk assessment. But at the end of the day, controlling the top 2 or 3 chemicals looks like it will be a very efficient way to address mixture risks.
Yeah. But this is in particular a sort of retrospective assessment.
So perspective, I think it's, the first part of my talk is that I think it is quite feasible in the near future to construct simulation models and then calibrate those simulation models with biomonitoring data to actually predict what are the patterns of co-exposures of chemicals and what are the relative ratios in them, and then turn to the toxicologist and say, okay, this is a specific cluster. What does this mean? What does it mean that these 3 phthalates are always elevated together? Are there interactions between them, or should I just continue to use a cumulative, a dose additive approach to them? And then I think that can really help direct efficiently the particular combinations that need to be investigated for toxicological interactions.
What kind of time horizon do you foresee for this to happen?
I think case studies could be done in less than 2 years, and a system could be put together in 5. If you ask, I've now given a total of 10 seconds to thinking about it. Those would be the numbers that I would pull out of thin air. And that Europe is really poised by all of the biomonitoring data that has been collected and the information on the sources of exposure to really take on a project like this.
Thank you, Paul. Christina, what would you comment on this, what you hear?
Yes, I think there is a lot of very interesting progress going on and developments, but I would like to remind you that to do all these models and new strategies like AOPs, for instance, the inflow of data, the generation of the basic data is really key. So I think it was Philip that started out his intervention saying, if we have the data, and that is really something that we need to take into account. And that goes for both exposure data, but not least the toxicity data, because we know we have problems with data availability and with data quality, and also with the transparency. So to make the data generated by the industry available actually for research. And PARC was mentioned, but PARC is not supposed to generate data on like basic toxicity data or exposure data for industrial chemicals or pesticides, because it's still the industry that is responsible for generating those data. And I think there is a very important step that we need to improve and increase the data requirements that industry should supply, and also align them with the needs of policy development. So what type of data would AOPs, for instance, need? What type of data would exposure modelers need to actually create these models in like 2 to 5 years, which seems like a very nice time plan. So that would be my important message, that we are no better than the data that we actually have to start with.
Thank you. I think Philip wants to respond to that, and then I will go to Peter to also like to hear his comments. But Philip, go ahead.
Thanks. I think we perfectly agree that the data are critical. For some substances, like the pesticide active compounds, we do already have the data, and we work already on doing combined risk assessment in the CACs. And EFSA has launched a project that aims at completing within the next 4 years other CACs. With respect to the substances where we do not have a lot of data, also PARC will be generating data. I'm sorry if I have to correct that. We will not do that for industrial chemicals or pesticide actives, because we already do have the data, and it's the responsibility of industry to provide these data. But we will do that also by standard toxicity testing for data poor compounds. So I think data will accumulate. And as 2 of my previous speakers have been referring to, that whenever we do these exercises, we see that typical specific compounds are really drivers of risk, either because they have high exposure or because they are tremendously toxic. I would perfectly agree that in future work, we also have to focus on these risk drivers to generate data for risk drivers. And I think this will be done as well. Thanks. And sorry, Peter, for...
Thank you. Peter, just you are from DG Environment. You're responsible for one substance, one assessment. You told about the MAF will be in REACH legislation implemented soon. Can you tell us a little bit more about that and what you have learned here as kind of steps that you can take also to add on to that MAF for other silos than REACH, and then go from one substance, one assessment to one mixture of, or multiple mixtures and one approach?
Thank you. Well, maybe I first react on the idea of data-driven. I fully support that. I have absolutely fully behind it, and we should use the data to protect the humans and the environment as much as possible, and all these things should be driven by that. I also want to plea on the little bit of the workability and doability of the approaches, and a little bit of realism here. When you think about the 2008 regulation on plant protection product regulation, maximum residue levels was, and then we have obligation to do the cumulative risk assessment, and when the methodology is available and also prospective. So now we are in 2022, and we are now looking at the retrospective. So I mean, I'm very happy with all the proposals. I'm fully behind it to support them and develop science, put the resources into this. But the reality is that imagine to achieve such a thing, what you are proposing in the next 5 years. I have a little bit of reservation whether we can do that in 5 years. The other thing what I would like to raise is that we try to also fit for purpose, that I a little bit benefit from your keyword. And is that, you know, we are looking at reach. And there, it's a reverse burden of proof. So basically the industry is put the responsibility to ensure that the chemical is made safely. So think from the perspective of a registrant. So it's that person who has to show that this chemical is safe. He needs to document it in the chemical safety report, and he needs to show that, to set the conditions how the chemical can be used. And I don't know how this person or this entity can actually use all those methodologies that we are proposing. And without that we take away from him the responsibility to prove the safe use. So from that perspective, I think a mixture assessment factor is a pragmatic and good way forward to deal with the scientific way of dealing with the uncertainty, which is there. And has a benefit that it, of course, addresses only those risk drivers or those which are with the highest risk quotient. That's kind of benefit of that approach. Saying that, of course, this is addressing, I agree with you, is only reach. Huh? So now we will look at, fine, this reach, we will put it in reach. And what about the others? What about all the other components of that mixture? Pharmaceuticals, pesticides, and so on. I agree we should work towards that as a one substance, one assessment, towards one approach to mixtures. But I think this one approach in mixtures will be not one. I think they have to be complementary. I think we should have a kind of approach where we have a pragmatic, where we don't know sufficiently, and wherever we know, wherever we can do better, we should improve that. We should do as much as possible based on the modeling, based on the exposure sciences, based on the new achievements in NAMs, screening, and so on. But I think it comes to time that we do something in a reasonable time frame.
Thank you, Peter. Almut, fit for purpose has been used, as we mentioned, and the Commission is also always one, so you must like what Peter said. And can you move on with his words and sort of a sort of tiered approach, perhaps, to tackle this?
Yeah, so first of all, of course, I mean, we have considered all possible solutions to the problem of mixture toxicity. We know that this is an issue, and we also are fully aware that this is now taking a long time, that we are working on the methodology, and that this methodology, in the end, when we implement it, will only be about pesticides for the time being. Of course, our ambition would be to develop this further and for the future to be able to also cover non-dietary exposure routes, but also possibly other substances, if that makes sense. And this is where my fit for purpose keyword comes in. It may not make sense for everything at the same time, and it may not make sense in this way for everything. We may have to reflect about differences between substances that are, for instance, on contaminants that are actually partially, we cannot remove them totally from the environment. Partially, we have to live with them. So there is already an inherent difference in that. So we may have to reflect how to deal with those different groups. So I believe there is some gain in reflecting on such a mixture assessment factor. In certain areas, it may be necessary to use it, but I also believe this factor needs to be supported by some robust science. So I think it may also be necessary, if we use such a factor, to define it and to say this is a size that should be used in this area, but for another area we might not have the same factor because the area might be totally different. It could complement more specific methodologies. And I think, and this is where the data question comes in, the big project and aim should be to really, really get as quickly as possible a very good database. And I was actually wondering, I was impressed by the exposure science presentation of Paul, because so far I think what we haven't considered much yet is that there are behavioral patterns which we don't really know where to get such data from. But that could be a very interesting feature that we maybe haven't really reflected enough about. We know what infants are eating, we know what elderly are eating, we have all this. But we don't know whether there is a pattern that a certain age group is also buying this and that. I guess that the supermarket chains with their nice cards, they have all this information and they are using it for publicity and marketing. But I don't think the authorities would profit from it. So I would actually be interested to better understand from which sources we could get such data in order to develop more targeted approaches for the future, also for other areas.
Thanks. That sounds like a question for help. I see it is time for the second poll. So, Paul, just wait for your response for after the. And the second poll is asking you to tell or to guess where most chemicals come from. Is it from? Can you read it? Food contact materials, from drinking water, from consumer products, from clothing, or from air? I think you should move it up the results, because now we see the outcome of the first poll. There's a fight between the food and food contact materials and consumer products. Yeah. Fortunately, we have the Clean Air Act, and there's nothing from air. And drinking water is also very, very pure and safe. I think we can stop the voting. So I think you all think that food and food contact materials and consumer products deliver the most of the cocktail of chemicals we are exposed to. Does that help you, Paul, in further attributing to the question that Almut is raising?
Well, just a response to the poll up there. So I think they are, the participants are reflecting the ideas that if you think about the average chemical that is manufactured or imported into Europe, how would that average chemical get to you? And how would it get you in high amounts? And consumer products and diet are probably a good guess for that. This doesn't mean to say that environmental sources aren't important. There are, in the United States, we have what we call the standard air pollutants, the NOx, the SOx, the PM 2.5. Those things are uniquely air. They do have tremendous impact on public health. They are important to regulate, but there are only 6. If you look at the vast majority of chemicals that are out there, it's probably a pretty good summary, in my opinion, to say that most of it is coming through either food additives or coming in through consumer products.
Yeah. And lots of chemicals can of course come via the environment into food and so on.
Mm-hmm.
Yes.
Yes.
Before we go on with this, I have a question from the audience to Christina. So, and the question is simply your concept of filling the cup. Does that take into account that certain chemicals may enhance toxicity? So it's not a simple addition, but in that case it could underestimate toxicity, underestimate the risk. Could you comment on that?
Yes, well, this sort of most widely used model in research, I guess, but definitely in the regulatory setting is the concentration addition model. And that would not take any synergies or antagonisms into account. It's just an additive model. What we do know is that antagonism and synergies are the exceptions rather than the rule. So we can see concentration addition as a reasonable approximate that will work in most cases, but it will not work in all cases. So in a few cases, it will underestimate risk, and in also a few cases, it might overestimate risk. But as a reasonable approximation, I think it has proven useful.
I think that's also supported by Kortekamp, I think. Moving on to this previous discussion on, you've got REACH, where the mixture assessment or mixture allocation factor will be addressed quite soon. And the follow-up is perhaps other sectors. But can we come up with something that comes across all these different legislation? Do you think that a single approach, which can still be different subheading, can have different subheadings, can be used as the way forward? Peter.
Yeah, I believe in evolution. So I think we need to move. What I've forgotten to mention before is, because I've seen that also Poland came to my mind, that it looks like we are more talking here about human health, but we should not also forget impact on the environment and all the methodologies that basically this CACs and is not really at the moment applicable to the environment. And I think so I believe that I think that these methodologies have to take into account and have to be adapted to the realities of the legislation, have to take into account the practices which we have, and have to be very well complemented. It's like with this one substance, one assessment. I love this word, one. I think I'm not so sure we really mean always one. I think we mean that it looks like one, but it can be separate, but it has to be very coherent, complementary, and so on. On that one, I believe, and I think that's what we should strive as much as possible.
Well, we're moving ahead on getting a big database on chemicals, hazards, chemicals, exposure, park. Talking about uncertainty across these silos, what would either limit this or perhaps help to overcome this? Perhaps Philip, can you?
I think one thing that has been done in the CAC exercises is to do a comprehensive uncertainty analysis, to get independent experts for both sides, exposure and hazard, to look at the existing data and to specify how large uncertainty is, and to calculate uncertainty to make it viewable. I think that's a scientific way of addressing uncertainty, and I think it's good that this has been implemented into the CAC process. Of course, with substances where we do not have a lot of data, uncertainty is higher. And then it's of course the question, what do we do to deal with this uncertainty?
And what would be your answer to that?
My answer would be to get rid of uncertainty by generating data, and to do that as quickly as possible. And as I see that point here, how to deal with the lack of data while the scientific world urges for a reduction on animal testing, I pretty much like that question, because this too goes into a direction where we are in Europe are working on several big projects. Risk Hunter is one of them, belonging to the ESPIS cluster, and in these projects we aim at really implementing ab initio testing based on modeling, based on in vitro models, making use of the AOP concept. And with this steps forward, I think indeed we can also generate data in the future based on AOPs without animal testing.
Thank you, Philip. Paul, how would you deal with uncertainty or overcome uncertainty?
Philip and I think...
Can you use the mic? Yes.
Philip and I believe, are cut from the same cloth on this, so it's very hard for me to add much to him. I do want to be encouraging to say that the value of proper organization, curating the data, documenting it well, gives some very surprising or unanticipated value. You find out that you actually know more than you thought. I mean, if you're trying to answer the question, exactly how much spray does someone use on their counter, how many milliliters of it, and to 3 decimal places, when they're cleaning their kitchen, it's uncertain. But then when you step back and have the perspective to say, what changes the risk finding? You might find that if I simply know within a factor of 5, is it 1 pump or 5 pumps, it doesn't matter, it's somewhere in between them, that level of information is sufficient in order to reach a finding of safety or of concern for individual chemicals. And you won't know that until you put together a system that allows you to translate the uncertainty in the measurements into final risk decisions. And that's something that hasn't occurred yet. But when it does, that will enlighten us into areas where we can live with uncertainty and other areas where we really need to spend the resources to improve them.
Thank you. Before I move on to Peter and Almut for addressing this as well, I want to address Christina on this, but also because there is a nice question from the audience which says, implementation of a math is science-based in what way exactly? Or is it just a way of dealing with uncertainty in science in the absence of data? Thank you. And you mentioned earlier that there is not enough data, while Paul and Philip tells you that perhaps well, glass is half full. and could you comment on that?
What I mean when I say that the use of a math is science-based is that we clearly see the need. We see that the current system systematically underestimates risk. So we are on a risky road here because we don't take these mixtures into account, and everyone agrees that this means an underestimation. So that's what I mean with science-based. And I would like to add, we have the whole system relies on simplifications and assumptions and pragmatism. So that is nothing peculiar about a mixture assessment factors. If we look at test requirements, for instance, we choose a number of tests, sometimes more, higher number, and sometimes very few tests. And we let those tests represent the environment and human health. That's a huge simplification. And we make the assumption that these few test models can present everything that we want to risk assess. And we do that for pragmatic purposes because we simply cannot test everything. So therefore, I think the pragmatism in a MAF is not much difference from the pragmatisms that are already in the system today. So therefore, I think combining science-based, and science-based is also about the size of a MAF. We can do case studies that indicates the size of a MAF. So it's no difference from the system today. We have to combine pragmatism to make it feasible, but also science-based approaches to indicate the size, but also clearly the need to embark on a less risky road.
Thank you, Christina. Then my question to Peter and Almut would be, how much certainty or uncertainty can you live with from the science, taken also into consideration then when making laws that you also need some other types of certainty or uncertainty or deal with uncertainty? Could you comment on this?
Well, that's of course a very difficult question, and I cannot give you a figure now on how much certainty or uncertainty we could accept. But I think what is important to say is that already today uncertainty considerations, and it was mentioned before, they are part of the scientific assessment process. The important thing is that we know at the end that there is uncertainty, and we can give or have an idea of the extent of the uncertainty. As regards what we can live with, there you are coming to the big question of what is our protection goals. Should they be the same over all areas? Should we have them defined in a broad way? That's very difficult. I can only answer, and it was already quite a lot of discussion for the area of pesticides. We discussed this a lot, and we decided on a protection goal, but this is a figure of the percentage of the population that would be protected, and it does not necessarily can or should maybe not necessarily be the same over the whole range of different areas. So I think this is one of the really important first questions. Can we define our protection goals? Can we then break them down more into specific areas and make them more clear, more specific for those? Do we need to have rules for this, or is our existing legislation sufficient? And I also would like to come back to the issue on uncertainty and lack of data. Of course, we know that we have a lot of data lacking, also in the area of pesticides. Basically, we know, for instance, we did not have data on use. We deducted use from the monitoring data, assuming that the substances found in the monitoring exercise would have been used, and that if several substances on the same crop were found, then there would have been use of two substances. But use data as such we did not have, and we also had some quite conservative assumptions related to this, knowing that there are uncertainties. So we also don't have a perfect package. And I don't think we need to wait necessarily for the perfect package. We can try to move on if we have an idea of what could be a factor that should be applied in certain areas, or if we know how much uncertainty we already have, we could try to use this. If a lot of uncertainty considerations already have gone in specific methodologies, I believe we don't need an extra factor for the same issue, but we might need if we extend the question to other substances that are not yet considered.
If I could rephrase my question, and coming back to also what Christina said, because the current legislation also expects some kind of protection goal or protection measurements in the way that chemicals are approved or whatever, authorized. If we look at the science that is there, it shows that there is a mixed toxicity effect. Could you use that to adjust your protection level and then move on?
The protection level usually comes from the legislation as such, and we don't have such goals in the legislation. So this is another quite important question that we must ask ourselves. The reason why in the pesticides area we have data and we have a methodology is because these data were required and because it was clearly stated that this methodology should be established. So without anything in the legislation, it is already much more complicated, and we can try to do our best with what we have, but protection goals need to be defined. And I think there is a legal aspect to them. So it is not something we can plug out of the air and ask applicants then to stick or to supply us data if we did not define what exactly we need. So there are also quite important legal considerations. But I don't know, maybe Peter wants to
Peter,
add something.
can you follow up on this?
Yes. I wanted maybe to take it a little bit from a different angle. Yes, we should strive to reduce the uncertainty to the minimum. And I just give you example. For example, if we are going to go for this math in context of REACH or anywhere else, we should try our best to define it such on the best data which we have now. So it's not shouldn't come out of. I feel it should be 10. Huh? And I think for sure. But then in the regulatory world, and considering the protection goals, you need to deal with uncertainty. So no, it's not a question how much you accept. It's more like what you do with it, and how. And that, I mean, you need to do something with it. And of course, that always depends on the scale of a problem, on the protection goals, and what are the trade-offs afterwards.
Okay. You want, Paul? Okay. I have a very technical question from the audience. So I will take that first. So how much emphasis should be on artificial intelligence while considering the exposure science and data-driven outcome on the risk assessment? And I think Philip and Paul can perhaps comment on that.
Yeah, thank you. Peter has been pointing out earlier that some things take quite a bit of time. And if you would like to know why, I would ask you either on your smartphones or on your computers at home to open one of the databases for scientific literature, PubMed, for example, or Scopus, or Web of Science, and enter a term, pesticide or dioxin. And what you then find is 10,000s of hits, 10,000s of data sets of partially very, very good scientific publications that contain information on your substance of interest. And if now a risk assessor has to sit down and read that in his risk assessment for that compound, that takes time, and even if it's like 5 or 10 risk assessors doing that on a specific substance. And here AI comes in. Thanks for that question. It's a very, very good one. There are a number of projects ongoing. One is ONTOX in this asbestos cluster. Another one is financed by EFSA. It's called AI for NAM, and there BFR is a partner in. These projects train artificial intelligence to read these literature, but also the data which is available under REACH or under the Pesticides Act in Europe, and that's also a horrible lot of data, to get out the points that we need, for example, as points of departure for mixture toxicity assessment. So to answer that complex question short, AI plays a critical role, and it is taken on board in a number of projects already, further developed, and hopefully will help us in the near future to reduce the time that we need and go forward to a better risk assessment. Thanks.
Paul?
I have limited experience with AI. This comes from being born too early. But I've been impressed over its ability to address some specific issues. We have, when I was at EPA, several of my coworkers were using random forest models to do some very interesting work. They were using them to predict, just based upon the structure of a compound, what function that compound would likely provide to a consumer product. In other words, just looking at the structure, would this make a good solvent? Would it be a good pigment? Would it be a good chelator? Would it be a good fragrance? And they trained the data set on published data records that says these are the functions that this data that these chemicals provide in these compounds, and they got pretty good at it. And this is really a useful tool because it enables a regulatory agency to take the structure from a submission on REACH and be able to say, well, this is what they said they're going to use it for, but here are all the other ways that it could potentially be used for as well. And so you're looking in the future and you can say, you know, this probably would be a concern if this was a solvent in the wrong type of product. So I think there are some incremental ways that AI can play a tremendously important role in improving our ability to do chemical risk assessment.
Christina, would you comment on this as well?
Yes. I mean, everyone is talking AI, and it sounds, of course, compelling, and I hope that it will solve a lot of questions. But the example that you open Scopus or Medline or whatever and find tens of thousands of publications on a single chemical, that's really exceptions. So I would say we have a very skewed distribution of information and data if you look at a broad range of chemicals. And for many industrial chemicals, you would find not a single publication. So I would still say that for industrial chemicals in particular, the basic knowledge about toxicities, exposures, content of chemical, of consumer products, emission factors, and so on. We know very, very little, and too little to put those into complicated model, even if we have AI, I would say. So we really have to work on the quality and availability of data still.
And from the Commission side, could you rely on AI developed or derived outcomes? Peter?
It's a good question. I would say yes. Well, I don't know much about AI. Probably I have enough to deal with my own eye, but it's I don't know. Depending, the thing is that I think what is important is that we need to understand what this AI is saying and based on which data it has been calibrated or taught. I am a little bit afraid of all these things, cautious, not afraid, cautious, because I want to understand it. You know, we have a lot of this kind of big modeling and big prediction and reducing uncertainties. We have seen it with a financial crisis that was based on the reducing the uncertainties, distributing the risk on the mortgages, and nobody really get it where after just 10 years later when it all somehow collapsed. So I'm all for all these approaches. They should be helpful, but we need to really understand what we do.
Yeah. So perhaps this is a message for the other session on new approach methods that hopefully will deal with that better. But you would rely on good science. That is, I think, very important. I have a question from the audience to Peter. Is screening mixture toxicity in an in vitro testing battery an option to fill some knowledge gaps?
Yes, it is, provided that you know which mixture you should screen. I think these screening methods, for example, are a very fantastic tool for dealing with environmental samples. So imagine you have a water riverbed, so you can have an effect-based monitoring, let's say, that you could easily have. And this is the way how you could little bit improve the dealing with chemical mixtures present in the water environment. So you focus on estrogenicity of water or whatever pathway you want to address. So in that way, for example, you can easily screen or wastewater effluents, you can screen very well. I think also all this toxicity, when we thought about how we could implement, or when we are thinking about how we can implement MAF in the REACH, yeah? So if we have to, if registrant have to consider it on risk characterization ratio, so he can actually look at it once is quite high, this risk characterization ratio. He can actually try to reduce the uncertainties which are there when he calculated or estimated the risk characterization ratio. And he can look on the exposures, which is predicted. He can improve it either by refined modeling. He can improve it by the monitoring, and for example, and also he can improve it by improving of the derivation of DNLP-NEC. So if that would be an appropriate tool, for example, through the in vitro screens and whatever, he can do that. So yes, definitely there are. Let's use all the tools to reduce uncertainty, but and try to actually make it as best as we can based on the tools which we have.
Thank you. Other who wants to know? Then I have another question. I think it has been addressed already a little bit about what about the use of human data in the relation to reduce uncertainty factors? For various contaminants, human data have been used, PARC have been used, and so on. Perhaps this also could be a question to Chris. How could we use that? Paul, Philip?
I think, well, first of all, thanks for that. Very good point. With respect to the regulation 1107/2009, which is the one for plant protection products, use of human data has been prohibited, and a minimum uncertainty factor has been set by the regulation of 100. So while for contaminants this may be a good way forward, I think for other areas of regulation it may not be. But this point is well taken because it opens the discussion on how do we come to uncertainty factors. And I think that this also needs some scientific discussion and maybe also the way just to say we have like 10 for species differences and then 10 for inter-individual differences is just a bit too broad, and we have to discuss whether this is needed overall. I can say that with the 100 that we have been using, we have done quite well in terms of ensuring public health.
Thank you. Anyone else wants to add on? Peter?
Well, I'm all for human biomonitoring and using this data as much as possible. The weakness, for example, what I see from the perspective, for example, from registrants is it takes a little bit of time to, and it's not a tool which you can just take like, screen and you have a result in 1 month or maybe half year. So and you have to have a biomarker develop, and it's not so simple, but definitely it's a very valid tool and we should use it as much as possible. But considering also its applicability for those domains where it is actually, this time issue is there. And also there is an issue of, do we really want to wait always until the chemical comes to humans to monitor it and then to say, we should have restricted it. So,
yeah. Paul, you want to?
I have worked in the past with toxicological findings that were done in human studies, and they make me very uncomfortable. And I'm very pleased that there's been a general societal decision not to do them any further. So my anticipation is going to be a very small number of chemicals where that data is available until there is a time that there is development of an ethical system for addressing, or a new technology for addressing how humans could be done. But the current time, I can't see that human data is a significant direction for us to be going in terms of improving risk assessment.
We're not allowing people from the audience to comment, but as I mentioned, Chris, and she raised her hand. Please come to the...
Yeah.
Yes, please.
So I understand. He's on. I understand that.
Please use the microphone.
I understand that there could be complexities with human data, but first of all, human data shows human relevance, right? If you're interested in mixtures of pesticides, and the pesticides are all endocrine disrupting chemicals, that's in foundation to all the other chemicals that humans are exposed to. So you're putting that on top of a very complex pattern of real human exposure. So I'm not trying to say that human data should rule the day. I'm trying to say it should be a supplemental strategy, should not be off the table. It should be relevant to evaluating what humans are exposed to. And if a new product is coming onto the market, it's relative to what else is on the market. And human data is maybe a way that could be incorporated for that. I would love to have an infrastructure set up where we evaluate various metrics over different locations, over different times, and evaluate what the impact is of new products or current products relative to what's already in humans. And yeah, it seems to me that human data seems very relevant to human health risk assessment.
Thank you.
Just wanted to add, if I make an impression that they are not, and I didn't want that. They are very relevant.
I mentioned Andreas' name, so he raised the questions to Almut. So his question is, your point on the legal mandate is well taken, but is the Commission working on a mixture mandate for food contaminants and for these plus pesticides?
No, there's no work from the Commission ongoing on any legal mandate. We have a general statement also in the General Food Law that refers to a cumulative risk assessment very broadly, as we have it, but it's a very broad statement that doesn't really target specific substances. But I think, it's still something we should keep in mind, because we are talking about how do we get better data, and legal provisions could be one way. Among other ways, I would not exclude this as a way. And listening to the last bit of the discussion, I just wanted to say that I also believe we have really no data for many things, but I believe we have in other areas, or maybe in some cases, we do have data, but we do not exploit them properly. We might not be aware they exist. We do not share them always in the best way, and maybe more could be done to really have the data accessible. Well, there is project ongoing under One Substance, One Assessment to this extent, and that is very important because for the moment, again, here we are having the different silos. If data would be better shared, but also if maybe data would become accessible wider than they are currently, some of those data could be very useful. Like for the exposure science, for instance, I believe there could be more that is possible if we had all the chance to evaluate them. And then artificial intelligence could be one way to be used. Although I'm not a specialist for this either, but I believe it would be useful because it would be a huge amount of data that we would have to look at and also find how they relate, whether they are really independent from each other or not. All of these things, there is certainly artificial intelligence needed to do that.
If I may ask all of you to sort of set up, design a roadmap. Obviously, REACH seems to be the first piece of legislation where mixture toxicity seems to be getting implemented. What would be the different steps towards such a roadmap? Perhaps first the scientists.
I think such a roadmap is about to be designed and published by EFSA. Of course, we as scientists may have a different perspective as the risk managers. So for us, the questions are more, what do we need in exposure science? What do we need in toxicology to derive hazard data? And I think that this roadmap, which hopefully will be published in a few months, will deliver some answers that I would not like to already.
But across the silos.
Across the silos, of
Yes.
course. That's. I think you may have seen my final slide where I had this substance by substance in the past and the silo, cross-silo regulation for the future. To achieve that from a risk assessment perspective, still quite a bit of data is missing. And the roadmap tells how to address these and how to not only generate the data, but also say where and in which projects this will be done in the next couple of years.
So it also tells you, or me, to deal with the substance for which there is sufficient information that can be implemented tomorrow.
Indeed. That has already been implemented, like in the plant protection products regulation.
Okay, thank you. Paul.
One of the works at EPA that really makes me proud to be an ex-EPA employee is the chemistry dashboard. And in that project, the data on toxicity, on exposure, on physical chemical properties has been curated, has been documented, has been brought together in an intelligent fashion so that when there are actual studies available, they bring the data from the studies with appropriate caveats and analysis to back them up over how they're derived from the studies. And when they're not, they use a QSAR to generate the estimate for it and then document the strengths and limitations of the QSAR. I think a model of, if it'd be possible to envision a model where you had an organization that sought to build on a chemical dashboard that would pull together the information together on the individual chemicals that are relevant to exposures here in Europe and are relevant to the toxicology, leveraging off of the work that's already been done in the US and elsewhere, might be a tremendous resource. And it doesn't necessarily have to be part of a regulatory program. It can be around communication, transparency, documentation. And then when you have a program in place, you do it intelligently so that your estimates of exposure for a given chemical may be set up in such a way so that you could add them. You know, that this is the distribution for a generic population with these demographics, so that you could then take that distribution and for one chemical and overlay it for a distribution for another chemical, and then make some assumptions about correlations, and rapidly generate descriptions of cumulative exposures from these sources as a screening exercise. So I think a communication tool that documents what we do know, how solid is the data, and then identifies, of course, data gaps that could be, that once they're identified, they could be filled with future programs, might be a good first step before, or perhaps parallel to, any system that tries to regulate across the silos.
Yeah. So from my understanding, a great gathering of all the data, tox, exposure, and then look from the silos whether you can use it and how you can use it for addressing mixture toxicity, right?
Correct.
Thank you. Christina.
Yes. We know a lot. So we have huge amounts of data on mixtures and mixture toxicity. So I think we all agree that we need to act on mixtures. And I think we already know enough to act now. So therefore, I think we should introduce a MAF as soon as possible. And that must not exclude making more science, building more models, generating loads of data on exposure and hazards, and doing AI and AOPs and whatever. But those models will take a long time to develop. It will take a long time to fill them with meaningful data and to validate them and to implement them in a regulatory setting, not the least. So my roadmap would really be to introduce a MAF now and then start building more information to refine the use of a MAF or supplement it with other approaches when possible, when we have the knowledge and when we have the data.
Thank you. Peter, Almut, would be your part of the roadmap?
I would to bit make more roadmaps. I think we have the legal obligations in plant protection product maximum residue levels and biocidal product regulation, and we should start to use them. So I would really focus now. Let's try to finish the CACs as soon as possible. Let's try to apply it progressively, and let's try to look at the food area, so these contaminants. Let's put them together, and if that Paul was right, that food is a big contributor to chemical intake, we would have at least very good understanding about the food area. I think that's that can be done. We have a legal mandate, I think, also in the general food law, and that could be as a one roadmap. In parallel, I would go, of course, it's a legislative roadmap, so something more for us, is to use to the maximum extent possible the current initiatives on the revision of existing pieces of legislation as part of the chemical strategy. The evidence or the experience shows that it is important to have it encoded in the legislation, that something is actually done. It's a kind of driver for doing it. So currently we are revising REACH. So let's have a look on this map, how the best to introduce it, how much it would best fit into the whole approaches together. That's one thing. Another part of REACH which is going to be revised is also information requirements. So do we need some better information requirements on exposure sciences? That's what we are looking, and we have a contract on that. We are finalizing this input, so please consider that. What would be the best things to, what would be useful to get there? Then we have another revision of legislation ongoing. It's the cosmetics regulation. There we are also looking at how to address mixtures. We are looking at MAF there. How shall we incorporate it? So let's move on there. We are going to, we are revising or looking at the food contact materials legislation. I don't know by heart how the mixtures are considered there, to what extent, because I don't follow it so carefully, but let's have a look there as well. And then we have a water legislation. So in water, of course, we are downstream, so we can't really regulate chemical there so much as mineral mixtures, but why don't we, let's use those effect-based tools to screen and ensure that the waters are protected from the effects, not individual chemicals. So this will be a roadmap for us. The timeline is quite short. It's 1 year from now, I would say, for all these legislative proposals. But then, of course, will be a co-decision process where the European Parliament and Council member states will have a say. So I think this is the roadmap which I would go for.
Thank you, Peter.
Sorry, and just in parallel, the third roadmap would be for research and for the filling all those gaps where we need and moving and refining and improving the thing.
Yeah.
Sorry.
If you put a staple through it, it will still be one roadmap. Almut,
Yeah,
the last words.
Yeah, well, I agree to many things that were said. So I also believe in the area of pesticides where we are already rather advanced, we should continue gaining experience, finalizing, using this experience, extending possibly to non-dietary exposures to pesticides as a next step, and then use those learnings for further discussions on possibly in other areas. On the legislation, I agree where there is currently ongoing discussions on major pieces of legislation. Of course, that should be part of the discussions because it will be helpful to have legal requirements. So that's clear also. And in parallel, I would also agree this research route. And there, I think probably because this is very complex and I have the impression a lot of projects ongoing, we need really some sort of screening for priorities. Where do we see the most important patterns of co-occurrence? Where do we see the areas where there is action needed? Can we focus on them rather than trying to cover everything at the same time with a huge amount of data that maybe in the end turn out to be not really relevant? So there, screening, also maybe the tiered approach that Paul was mentioning can be very, very good in this area to really focus and make up a better planning for this part, which seems to be just a huge amount of data that we have to somehow manage.
Thank you very much. And I also would like to thank all panelists, all members of the panel for your lively contributions and optimistic, constructive contributions. Give him a hand. And I return the floor to Suzanne.
Okay, I think we now move. Sorry. Thanks a lot. This is not working. Does this work? Yeah, it does. So I'll immediately pass the floor on to Jakob, who will try to wrap up this session in a few minutes, actually. So this is a difficult task. Yeah.
I hope I got 10 minutes for this. But indeed, the challenge here today is to learn from each other, to learn from different regulatory silos, but also to learn from the US EPA and Europe what's going on, what can we do the best. We had very interesting presentations from science in the US, from Chris, on what can you do with HPM data, how can you derive a mixture of concern, how often does that occur in society or in EP cohorts. We had tiered approaches where EPA is the lucky situation to have a lot of data on consumer articles. But we see also in Europe things are moving forward in different roadmaps and in different scientific data-driven, like Philip presented, but also concerns in other areas where we don't have the data, like in consumer articles, and where maybe additional effort is needed or additional factors should be included, like an allocation factor, as we heard from Christine. So all those lectures provided a very good basis for further thinking about how could we work together, where can we find the synergies in how to work together. And that's not bounded anymore between one regulatory silo or one scientific institute. So it's one that should come together if we think across the silos, also working together. The good news is indeed that a lot of things are going on, like the Park Initiative and the roadmaps that were mentioned by Peter, and the regulatory roadmaps that are on the radar. The screening methods, where are the priorities to be set, where do the problems occur, which you can also see from HPM studies, I assume, from what I learned from Paul and Christina. But anyhow, these introductions were very fruitful to give a mindset on the discussions we held. So a poll was held to ask you about what is your impression, how are you engaged in the discussion, and what do you think is the most important keyword here. Then we had a close finish between data-driven and exposure science, and we continued on that aspect. So what did we learn from the data that we have at hand today, particularly in the silo of pesticide plant protection products regulation. And there the methods are very well developed. There is a level of a threshold of regulatory consideration. Methods are there, accessible to the member states. And progress will be made in the coming years to extend more assessment groups, if I understand Philip correctly. But it's not complete, as Almut said. Non-dietary is not combined with diet, and there are some issues might be encountered in the coming years, but EFSA and the Commission have a kind of roadmap there and a kind of action plan to think on how that could be done in the nearby future. Then we touched also upon what happens if an adverse outcome fact is not only caused by pesticides, but also by a contaminant or by an additive or by another route of exposure, like the consumer articles. Where do we find those data? And I think we can learn a lot from Paul there, where you have a lot of databases on consumer articles, or you look at labels on concentration ranges, and hopefully these are something that is also then being explored in future roadmaps. So then the second poll was about what do you think is most important in the sources of exposure? Does it come from the food? Does it come from the consumer articles or the air? And where do we gain, where do we see the most impact of that source of exposure? We didn't discuss the latest, but then the audience thought it's equally consumer articles or food exposure. It was about equal in that respect. And we started to discuss, so what could we then improve on all those thinkings? Where are the elements we can cooperate on, or where do we see the challenges for the future? So we touched upon artificial intelligence, and that might have a future to go through documents where a lot of information is hidden in dossiers and come up with useful information. But we also touched upon the time scale. So artificial intelligence is typically innovation, which might be a little bit later on the road to be mature, to be helpful. And there is a need to act now on the mixtures and the concern of mixtures that we see. So what are the short-term goals here is to improve indeed the data sharing, and the transparency of the data was mentioned as something that we could work on quite nicely in the nearby future. I know EFSA is doing a lot of work there with open food talks, the dashboards as mentioned by you, which chemicals are used where. I also know that in PARC, the human biomonitoring data will be shared and will be used in things that you are doing similar. Where are the health impacts? Where are the AOPs and the biomarkers of effect that are of concern? So a lot, and that was also the expected outcome of this discussion, is about innovation and how could it be used in the short term, and then I talk about it 5 years from now on, 2 to 5 years. Where can we benefit if we share the data a little bit better in Europe? Because Europe is, well, 70 countries. You are lucky in the US. You have a little bit more control about your states, at least for a long time. But anyhow, sharing data and making data transparently available for risk assessment, but also for the community, and is a very important thing to do, as we discussed. So Dick started with blood experiments that he had to do 20 years ago, and he found some PCBs in his blood at that time, and we talked about the legacy chemicals PCB are there simply in our environment. But of course it alarms the public if you see that chemicals are in your blood or in your urine. So you have to think about also the human biomonitoring findings, and that's indeed a cross-silo issue. As you monitor the right things in the human body, and if you understand how that relates to the risk mitigation later on, and that was nicely showed by you, Chris, that you did an experiment in the SELMA study, and so we can learn from that, and we can use that example and make that more workable, either in EFSA roadmaps or in PARC or wherever we see the synergy to do so. So that was all great, and I think then we identified a lot of these synergies. We talked about where should the roadmaps being built, or who is working on roadmaps, and well, the good news is that there are many roadmaps, and that the issue on how to process progress into the future on this sensitive issues that has not been implemented for 15 years and that needs acting now. That we see that roadmaps are being built everywhere. So Philip mentioned one of EFSA. Peter mentioned the regulatory roadmap, that in different pieces of regulations they start to think on, well, the strategy is nice, but now it needs to be implemented in your regulation, and for this you need a roadmap. Environmental risk assessment might benefit from effect directive bioassays, but I didn't hear you talk about how that will be applied in humans, but of course NAM technologies, bioassays might help to understand indeed the impact on the mixtures on an AOP, and that can also then be linked to the human body at the end of the day if you link the effect to a biomarker of effect, as what you did, if I understand you correctly. So a lot of things are on your plate, particularly also in Brussels, on how will you proceed with these pieces of regulations, action plans, roadmaps. Yeah, and the good news is that a lot of things are going on, and hopefully we can also benefit from the recommendations from this nicely organized workshop from EFSA in close cooperation with all the other agencies and the Joint Research Center. And yeah, I hope I did my best to wrap up this broad area of science, political arenas. I tried to do my best, but anyhow, this is giving back to you now, Susanne.
Thanks a lot, Jakob. It was certainly a lot of ground to cover in a few minutes. So yeah, and I think I want to thank all the contributors to this session, and the audience for your comments and your questions. I think it's the task for EFSA now to put it together and see where this, in a very, I guess, concrete manner, where that will take us, because we need to again come back to we need to think about the implementation now on what we have, and then we have the several tracks on the data generation. Before I close this session, I would like to invite the audience to connect to meet the session contributors. And there Almut, Chris, Philip, and Paul kindly have volunteered for further interaction here. You will connect to them via the app again. So I am not going to give you guidance on that. I hope this will be intuitive. I want to also, just as the final remark from here, remind you on the session tomorrow, or the many ways track will continue tomorrow morning at 9 o'clock. And I only want to wish you to have a nice evening here in Brussels again, and thank you.